Hi everybody, thank you for being here today. Thank you for joining us for Open Day and thanks for coming to our session on osteopathic medicine. I'm Suzanne, I'm part of the Future Students team here at SCU, and thanks for joining us on the lands of the Bundjalung Nation, who are a people who really value storytelling and learning through storytelling, so it's very fitting that we're doing that in this place on this land today. So thank you for being here. We're joined today by an expert panel in this field, so you'll learn a lot more from them than you will from me. So we're joined today by Raymond and Angela. So Raymond's a lecturer here at Southern Cross University. So, and you're also a member of the Osteopathic Research Advisory Group, is that what it's called? Yes. And Angela is a recent graduate and working in the field. So thank you so much for being here today and joining us. And I just thought we'd start today if Raymond wants to tell us what osteopathic medicine is, osteopathy is. I know.
Osteopathy is a form of manual therapy. As osteopathic practitioners, we perform treatments and diagnosis using our hands to treat and diagnose various conditions of the body. As primary contact practitioners, we need to be competent at diagnosing or assessing whether it's safe to proceed with a manual therapy assessment. And so we need to understand pathology, the function of the body, the structure of the body, and we need to be able to use our hands to treat and diagnose these conditions appropriately. Yeah. So that's why the course is so long, because we need to understand all these other factors as well and be a safe practitioner.
Amazing. Yeah, and how long is the course here at Southern Cross?
We offer a 3-year undergraduate degree and a 1.5-year master's degree. Yeah. Upon successful completion of both programs, students are eligible to apply for registration as an osteopath here in Australia.
Great. And is that exactly what you did, Angela?
Yeah, exactly.
Yeah. And what made you want to take this course of study here at Southern Cross?
I had originally started in a field of manual therapy as a massage therapist. I'd done that for 17 odd years, and I just felt there was more required from what I could do, and I needed the knowledge and the language to do it, which is what uni gave me.
Yeah, great. And what made you choose Southern Cross Uni, and what did you love about studying here?
I chose it because it's a smaller campus. It's nice and intimate. The classes are a lot smaller, and the climate's a lot nicer than some other universities that offer the course. So.
Yeah, and you're a local, Lismore?
I moved from Central West New South Wales to Lismore and stayed in Lismore following the course.
Yeah, wow. Great. That's a big decision for you and your family to move across.
It is.
Yeah.
I had 2 small children at the time, so it was quite a big decision to make.
Yes, yeah. And no looking back by the sounds of it.
No, everything's worked out really wonderfully.
Yeah, that's amazing. Thank you. Okay, sorry. Are there any questions from you guys so far? Welcome. Hi. About what the course of study is, the period of study? No? Raymond, do you think you could tell us a little bit about how we teach here at Southern Cross and what's involved? Hi, welcome.
The university changed its whole delivery system, and we use now what we call the Southern Cross model, which is 6-week teaching terms, and a full-time study load is 2 units per teaching session. And I think that new teaching model makes it a lot easier for students to study whatever they're studying, specifically osteopathy, which is what we're discussing today, because previously they were studying 4 units at a full-time load, and so when assessments came, there were 4 different units they had to study for.
Yeah.
Nowadays it's only 2 units, and I think that makes it a lot easier.
Do you find it's a lot more manageable for students to just focus on the 2 at a time?
Yeah, exactly.
Yeah.
Okay. And I think also having quicker turnaround times with assessment items, having units delivered quicker makes it easier for students to study as well, and to assimilate and understand the content more better than the old program.
That's great. So yeah, we moved to 6-week terms, and there's 6-week terms a year. For osteopathy, the subjects offered in all the terms, do you know?
I think another advantage of the 6x6 is that students can study some units, depending on the offering, more than just once per year.
Yes.
And so common units, which are shared units with other healthcare disciplines, are offered more than once a year, so students could study other units instead of a very prescribed way of studying it per term.
Okay.
And they may be able to study quicker that way as well,
Yeah.
complete the course quicker.
Yeah, so they could pick it up if they need to. Was that your experience, Angela, that you could sort of study at your own pace?
I wasn't here for the 6x6 when it came in, but based on the course that I did do, the degree in the structure that it was, I was able to do subjects over what we would call summer term. So I could spread my subjects out. I was working full-time with 2 small children and trying to study full-time at the same as well. So I was able to manage all of those things by spreading my units out. So yeah, it made it a lot easier to get through it.
Yeah, that's pretty amazing. Small children and studying.
It needs to
Yeah.
be emphasised the flexibility is possible with the new 6x6, but also even before that, students can study part-time or full-time. And I
Yeah.
think that allows students the flexibility to still cope with their work or their family or other non-academic responsibilities.
Yes, which I think everybody here would understand that we all need to work
Indeed.
while we're putting ourselves through study. Any questions at the moment of what we've talked about so far? The course, I know some people have just arrived. Did you have any questions yet? We will open the floor a bit later as well. No? Okay. So
Don't be scared. We're
yeah.
not scary people.
No. Yeah, don't be scared.
Can I just outline
Please, yeah.
just a bit about the program? As I said before, it's a 3-year undergrad degree. The earlier years, there's a preponderance of the basic sciences as well as common units. So there's anatomy and physiology and pathology, as well as the practical hands-on units or subjects that students study. And then as students progress to the senior years, there's more clinical placement within the clinical facilities here at Gold Coast campus and Lismore campus, and students complete more hours in the clinic, utilising their osteopathic skills under the direct supervision of clinical supervisors.
Yeah, that's great. And you read my mind because my next question was to talk about how involved those practical placements are. I know one of the things that sets the course apart is how much practical work is involved in the degree, so our graduates are really prepared. And did you feel that way going out into the field as a professional?
Absolutely. So a majority of the clinical placement will happen on the campus, which means you're not having to travel elsewhere for placements. You're not having to uproot your life once again if you've moved to study to then go away for 3, 6, 12 weeks to do your placement hours. They're all here on the campus. So everything's all encompassed, all in one. Being that there's a lot of postgrads within the area, there's also the option to go out and do clinical placements and observing with those other practitioners in the area, and they're all quite willing and happy to share their expertise and knowledge.
That's great. And do you know how many hours in the course?
The exact number of hours I don't have offhand,
No.
but a majority of the clinical hours or requirements are performed, as Angie said, within the clinical placement here at SCU. We call them internal clinical placements. Students can also perform clinical placements with private practitioners or group practices, as long as that practice or individual practitioner has an agreement with the SCU. They can claim their hours as part of their education here at SCU.
Yeah, that's great. I do see that pop up on socials quite often with we've got our students out on placements, and I think it's something that sets all our degrees apart, is really preparing students to go and work in the
Can I also
profession.
add that because we have a clinical facility here and at Gold Coast campus, we have quite a eclectic collection of practitioners who are our clinical supervisors, plural, both who are alumni, graduates from here, but also from other osteopathic programs. So students get are exposed to a variety of different osteopathic approaches and technique procedures within their clinical placements as well.
And I imagine that's quite important to understand that there's more than one way of doing something. Yeah.
That's correct,
Yes.
indeed.
I'll just add, I run a clinic here in Lismore, and we have 4 osteopaths within our clinic. Of the 4 osteopaths, none of us treat the same. So osteopathy gives you the freedom and flexibility to approach the body differently and look at it with a different view. Even though everyone gets the same training, we all have a variety of ways in which we interpret that and a variety of ways in which we approach treatment of others. So it's really important to know that you're not kind of locked into something, which is one of the reasons I love osteopathy, because I can use a whole variety of skills that I've been taught to deliver a unique approach for each individual patient that I see.
That's a good segue into explaining that within the osteopathic program here at SCU, students are exposed to a variety of different treatment approaches within the curricula, and so that facilitates that diversity of approaches of osteopathic healthcare. So in other words, students have a variety of different osteopathic technique procedures that they're exposed to here peak professionally.
Yeah, that's pretty amazing. Would you say that's quite unique amongst the courses
Indeed
offered
it is.
around?
Yes,
Yeah.
it is, definitely.
So setting us apart in terms of this degree, the practical placements, the 6-week terms, and the approach to an understanding of different methods.
Yes, it is.
Yeah, that's great. Could you tell us, Angela, about your life as a student, and if you experienced any student associations or support services or anything like that, life here as a student?
It was really good because we had a lot of social gatherings. There's within the quad up here, just outside where we are at the moment, there's often quite a few different things running. There'll be live bands, there'll be like wellness Wednesdays where you can come and kind of get a little bit crafty. There's places to go to sit down, have a bit of time out, just relax. There's plenty of support on campus as far as people who need that extra person to look up to or someone to assist them with assessments. There's always some help. And I think one of the big things for me was the uni mentor program. So I had someone sign up to be a uni mentor who was a year or two above me, and now she actually works in the clinic with me. So that was a really nice kind of introduction to uni and having someone that I went through with and that was able to support me with things.
Yeah. Did that help you with your career and getting work with her, or was it coincidence?
It ended up being coincidence, but it was nice coincidence.
Yeah, that's great. And did you join any student societies or have anything like that when you were...
I didn't.
Yeah.
I would have loved to have had more time to do that.
If you're not a mother of young children
studying full time and also
Yeah.
working, definitely reach out and enter into those groups and find your little niche.
Yeah, and a lot of support available. I think one of the unique things about Southern Cross is that you're not a face in the crowd. We don't have huge lectures, so part of changing our teaching model was that it's smaller classes. I don't know if there's any large exams in the course.
There are plenty of exams
Plen-
everywhere throughout
plenty
the
of
program.
exams,
Yes.
yes.
However, can I add that there are small student cohorts, and the support amongst the student group is quite supportive and helpful, as well as we as osteopathic teaching staff are here to help, assist, guide, direct students in their osteopathic journey as well.
And so it's fair to say you'd know who your students are, they know where to find you for support and to ask questions. Yeah, so for degrees where you have clinical registration, for example, like this course, there's still some exams, but classes are small, support's available, you're not just a number, you won't just be lost. There's a first year advisor program when you start, so there's an allocated advisor to you, so you don't have to know where everything is in your first few weeks here. There'll be someone who will help you navigate through that if you need anything at all. And then as you progress through your studies and become sort of more familiar, you'll reach out to different support services as well. We have a client services team for current students, which is actually based where we're sitting here. So open all day, every day to assist students. So it could be anything from study plans to wanting to know, about scholarships or that sort of thing. So there's a lot of support available across all our campuses for students as well. So we will be around to ask any further questions. Was there anything else you wanted to add about the course, Raymond?
Come and study at SCU.
Yes, and you will have Raymond as your teacher. Yeah,
You will see Raymond around the campus a lot.
And Angela, you happy with your career choice and study choice?
I wouldn't change anything about it. So if you guys do end up coming, please reach out to do some clinical hours and come and observe me in my clinic.
Thanks so much.